Hello everyone. Today we are going to discuss about Neuro Mini Mental Status Examination. I am Vinoli, tutor of Triple College of Nursing. See what are the objectives we are going to discuss. Introduction about the neuro assessment, some terminologies, subjective data and objective data, mini mental status examination, Glasgow Coma scale, and finally conclusion. Understand what is the neurological examination. A neurological examination is the assessment of sensory neuron and motor responses, especially reflexes, to determine whether the nervous system is impaired. This typically includes a physical examination and a review of the patient's medical history, but not deeper investigation such as neuroimaging. And it can be used both as a screening tool and as well as the investigative tool. Terminologies: alert, which means awake, looks about, responds in a meaningful manner to verbal instructions or gestures. Drowsy, oriented when awake but if left alone will sleep. Confused, disoriented to time, place, or person. Memory difficulty is common, has difficulty with the commands, and exhibits alterations in perceptions of stimuli, may be agitated. Stuporous, generally unresponsive exposed to vigorous stimulation, may make attempt at verbalization to vigorous repeated stimulus, opens eyes to deep pain. Comatose, unarousable and unresponsive, some localizations or movement may be acceptable with the comatose category. Depending on the coma definitions, examples light coma to deep coma, does not open eyes to deep pain. Assessment of nervous system, it has a three division: a subjective data, objective data, and diagnostic studies. Subjective data, which means health history and nervous system. Here involves health perceptions, health management system, and neurological and metabolic pattern. Here can ask to the patient what did the patients eat in the last 24 hours, or any special diet whether the patients are taking, and elimination pattern for the per day. What is the how is the elimination pattern level, whether it is normal or any other compliance patients having, and activity exercise pattern, like whether patients doing any exercise, if so what type of exercise and how much they are doing, and sleep and rest pattern, how many hours of the sleeps the patients is getting per night, and cognitive and perceptual pattern, self perceptions and self concept pattern, and role and relationship pattern, sexuality and reproductive pattern. Here patients have physical problems interfere with the usual sexual activity, so the neurological problems may interfere with the sexual activity. Coping stress tolerance, here the how the patients deal with the stress. The stresses can cause headache and trigger and exacerbations of the mental status. And value and belief pattern, here what are the patients religious practices and beliefs or cultural influences and regards to the healthcare. So here which this all kind of the values and belief patterns which may affect the patient's healthcare practices. Other specific data like a headache, head injury, dizziness or vertigo, seizures, tremors, weakness, so all that we have to find out. Coming to the objective data, here are 6 subjects of the neurological exams. Here the first mental status examination and cranial nerve examination and motor system, and cerebellar and coordination and sensory and reflexes. Now we are moving to the mental status examination, which means it helps in screening to look for evidence of involvement of higher mental functions, which will be involving appearance and attention and orientation, memory calculation, and abstract thought and recall and language. Appearance. Look the age of the patient, observe the physical features of the patient that are associated with certain conditions such as almond shape eyes associated with the Down syndrome. And the second, check the grooming level of the patient, whether the patient is dressed appropriately for the situation and the weather, and monitor how the comfortable of the patients are in social situations. And third, observe the body language of the patient. Here the examiner should look for the movement that are characterized of certain conditions such as excessive movement or muscles contractions. And facial expression, the facial expression to check a good eye contact, a smile, frowns appropriately. Orientation and attention. In orientation, how to ask to the patient like time, place, and persons. In time, for example, what is the day is it? And place, for example, what is the name of the place we are in? And persons, what is your name and who I am? So like that. And attention, for example, a digit span attention thing, and tell the patient that you want him to repeat the same that you give him. For example, when I say 1 2 3, you say 3 2 1. Coming to the memory. Memory, it has three types of memory: immediate memory, recent memory, and remote memory. In immediate memory, tell the patient that you want him to remember the name and object or number. For example, cat, cows, sun, watch, Chicago, and ask him immediately to repeat the bag. Coming to the recent memory, ask the client to recall information given early in the interview. For example, the name of the doctor, like that. And coming to the remote memory, ask the client to describe a previous illness or surgery. For example, 5 years ago, or birthday, or any anniversary date, and all can ask. And what is the normal findings can be expected? Correctly answer questions, recent events with delirium, dementia, depressions, and anxiety. Unable to recall past events with a cerebral cortex disorder. And what is the abnormal findings can be expected? Unable to recall any remembered things. And in the calculation, there is a attention span and calculation. Here asking the client to recite the alphabet or to count backward from the 100. Test the ability to calculate by asking the client to subtract a 7 or 3 progressively from 100. Example: 100, 93, 86, 79, or 197, 94, or 91. And what is the normal findings can be expected? Normally, an adult can complete the serial events test in about 90 seconds with 3 or few errors. And abnormal findings finds difficulty to recite the calculations in our brain disorder. Coming to abstract thought. Here, tell the patient to explain the simple proverb. For example, all the glitters is not gold. Face is the index of the mind. Normal findings explains a proverb accurately. If a patient is having abnormal thing, unable to give abstract meaning in mental retardations or delirium or dementia. Coming to judgment, judgment asks the patient, why did you come to the hospital, or what do you do when you have a pain, like that. And in language, point to common objects and ask the client to name them, and ask the client to read some words and to match the printed and written words with the picture. Glasgow Coma Scale. The Glasgow Coma Scale provides a more objective way to assess the patient loss of consciousness. It evaluates the best eye response, best motor response, and best verbal response on a scale of 3 to 15. 15 highest score indicates that the patient is awake, alert, oriented, and able to follow the simple commands. Three lowest scores indicates that the patient does not respond to any stimulus and has no motor or eye response, reflecting a very serious neurological state with poor prognosis. And let's see the components of the Glasgow Coma scale. First, the eye open. If a patient is spontaneously opening the eyes, is to give the score 4. And to speech, while you speaking the patient, so the patient is opening the eyes, to give the score 3. And to pain, to giving the pain stimulant to the patient is opening the eyes, to give the score 2. And no opening, spontaneous no, to speech also no, and to pain, to stimulating pain also the patient not at all opening the eyes, to give the score 1. And coming to the best verbal response, if patient is oriented, to give 5 score. And the patient, if you're asking something, the patient is having a confused state, the patient is not giving the proper answer, to give the score 4. And inappropriate words, okay, so he give the score 3. And incomprehensible sounds, the patient is trying to speak something, but the sounds only coming but not coming the proper words, to give the score 2. And no responses, whatever you are asking, verbal responses, the patient is not at all answering, to give the score 1. And coming to the best motor response, here obeys commands to give the 6. For example, if you ask the patient to raise the hand, or raise the legs, or lift the some parts of the body, if the patient is obeying the things, so to give the score 6. And localized pain, if you ask to do the patient mobilize or the body parts, if that time the patient having a feel pain, to give the score 5 mark. And non-purposeful movement, if patient is non-purposefully shaking the hands or legs or something, to give the score 4. And abnormal flexion, if you are trying to extending the hand also, if patient is flexing abnormally, to give score 3. And abnormal extension, to give the score 2. No response, if you are asking the patient to mobilize or raising the legs and hands, the patient is not obeys, so give the 1 score. I hope you all understand the mini mental status examinations. Thanks for watching.